Hi, my name is Manon Labreche. I'm the manager for the injury prevention team. The intent of the video today is just to provide you some ideas and suggestions on how to introduce the new Safety Matters brochure to your patients. Good morning, Robert.
Good morning.
How are you feeling today?
I'm okay.
You're okay? My name is Manon. I'm going to be your nurse today.
Okay.
And a good time to introduce the brochure is when you're doing your safety agreement with your patient. So we're going to do a little safety agreement today, but I'd like to review a little brochure with you today because I know you just came in onto our unit today.
Yes.
And your safety really matters to us, and I'm sure it matters to you as well. So we just want to review a couple of things to make sure that you're safe here while you're in the hospital.
Okay, sounds good.
And we're going to go over how we can work together because we have to collaborate to make sure that you're safe.
All right.
Okay? We're going to talk a little bit about falls because falls are preventable because we have a lot of people fall in the hospital. Do you know why people fall, Robert?
I guess they're just weak and fall, or maybe medication.
Yeah, so they might be weak. They might be taking a new medication. You're not used to taking medication and you just had surgery, so sometimes medication can make you dizzy. It can make your blood pressure drop. So medication change could definitely affect fall rate. So we want to make sure that you know what you can do to make sure that you don't end up falling with us.
Okay.
So medicine can definitely do that. Or if you've been in bed for a long time. Sometimes if you're in bed for a long time, your legs might be a little bit weak. Just after one day of being in bed, that could really make you much weaker. So that's why we're going to go over some things that we can do together.
Okay.
Getting up too fast. That's another reason why people fall. So people fall if they try to get up too fast and go to the bathroom without any assistance. All right, so you always want to make sure that you call us when you need to use the bathroom. That's when a lot of falls happen, is when patients think they can get up by themselves because you were independent at home, right, Robert?
Yes.
So you look like the kind of person who doesn't like to inconvenience anybody and ask for help, but it's really critical while you're in the hospital that you use your call light every time you want to go use the bathroom, and most of all, you want to make sure that you wait because that's when a lot of falls happen.
Okay.
All right. So
all right.
You never want to get up too fast, and you always want to wait for us and use your call light. So those are other reasons why people fall. And when people do fall, it's not just like getting a little bruise. You know what can happen if people fall?
Oh, you can get hurt.
All right. You can get hurt. You might break your leg. You might hit your head. And sometimes that requires surgery. So we don't want to keep you away from your loved ones any longer than we need to. So that's why working together to make sure that you're safe will be really important.
Okay.
Okay. So I'm going to just kind of go over a couple of things that you can do to make sure that you're safe. And I'm going to go over a couple of things that we're going to do while you're here. The first thing we're going to do is what we call purposeful hourly rounding. We're going to try during the day, every hour, to come round with you to see if there's anything that you need. And that's a really good time to use the bathroom. So we're going to make sure that if you need more medicine, we'll give you medicine. Make sure you have your personal belongings with you. If you need to use the bathroom and everything's in close proximity, that's a good time for us to make sure that we meet your needs.
Okay.
At night, they're probably going to be rounding approximately every 2 hours or so. Okay. We're also going to perform a mobility safety check, and I'll demonstrate that at the end because every time we get you up out of bed, we want to make sure you're safe and you're able to stand on your own 2 feet. Okay? So I'll explain that a little bit further. If we think you're at risk of falls, we might put a yellow wristband around your wrist, or we might give you some yellow socks. And if we think you're a little bit higher risk, in that case, we might put a bed alarm, a chair alarm, or even a fall mat. So those are all precautions that we're going to take based on what we think your fall risks are.
Okay, sounds good.
All right. And then last but not least, if you're really struggling with getting up out of bed, which you look like you're pretty strong, so you probably won't need our injury prevention or lift team, but for some patients that have a really hard time getting up out of bed, we might call on our specialized team, and they're going to use specialized equipment like ceiling lifts, floor lifts, equipment that'll be a lot more comfortable for patients to get up out of bed. So that might be a little bit different than what you're used to if you've been in other hospitals. We want to make sure that you're safe and our team members are safe. So these are some of the things that we're going to do to keep you safe. A couple of things that you can do to keep yourself safe is when we do round Robert, please make sure to take the opportunity to use the restroom at that time. Have you ever been on a long car ride?
Yes.
Yeah. So if you're not going to have another rest area for about 90 minutes, most likely you're going to get up and go to that rest area and use the restroom, right?
Yes.
So it's going to be the same thing when we round with you. that's a really good time. Even if you feel like you don't need to go to the restroom, we're here to help you at that time. So
Okay.
that would be a really good time to go use the restroom.
Okay.
Okay.
Restroom and rounds. Okay.
That's right. Very good. Also using the call light. So if, let's say, you do go to the restroom with us during rounds, but then in between rounds you need to use the restroom.
Right.
What should you do? Should you get up by yourself?
I should call for help.
Right. How are you going to do that?
Call light. Call the
Yes.
nurse.
So you're going to use the call light and you're going to call us, but most importantly, you're going to wait for us, right?
Yes, I'll wait. Yes.
Very good. And it's not an inconvenience. That's what we're here for,
Oh,
right? We want to
okay.
work together. And every time you do get up out of bed, you see those yellow non-skid footwear?
Yes.
So we want to make sure you always have something on your feet so that you're not slipping.
Oh, that's what
Okay.
those are for, huh?
That's right.
Okay.
And bed alarms, again, we mentioned other interventions that might be a good reminder. Right now, we don't feel like you're at risk of, a big risk of fall, so we did not put a chair alarm or a bed alarm, but those would go off if you got up out of bed as a reminder. And then when we do get you up out of bed, we want to make sure that, you go very slowly, don't go too fast, and really be mindful of your environment because, these rooms can get a little bit cluttered with personal belongings and other things, so we want to make sure you're not slipping, tripping, or falling over anything that's on the floor. So be very mindful of your environment when we're walking you to the bathroom.
Okay.
Okay?
Sounds safe.
Do you have any questions on that or what you can do and what we can do?
When do we start the mobility?
Actually, that's the next thing we're going to go over, Robert.
Oh, okay.
So this brochure explains to you the color level. Okay. So every time somebody gets up out of bed, make sure you hold them accountable and ask them, are you going to do my mobility safety check?
Okay.
And this takes no more than 30 seconds, Robert, but we just want to make sure that maybe they'll change your medication. Maybe you'll feel weaker one day. So we just want to make sure that all of the care team knows how you get up out of bed so that we're all consistent with how we get you up out of bed and what kind of equipment we're going to use. So
Okay.
the first thing we're going to ask you to do is roll over from side to side. If you're not able to roll over from side to side, then you would be considered a red or level 1, and that's what we would tell the care team you are.
Okay.
Once you're able to roll over from side to side, we'll have you sit on the edge of the bed, and we're going to see if you're able to sit there for about 2 minutes. If you're able to do that, we'll have you move your arms and legs. And if you're not able to stand, the next step would be to ask you to stand. But if you can't stand and all you can do is sit on the edge of the bed,
Mhm.
then you would be a level orange, which is level 2. Once you're standing up,
Uh-huh.
we're going to have you stand up there for anywhere from 10 seconds to 2 minutes. If you're good with standing, and we'll move on to the blue level. And next is to see if you can march in place.
Okay.
If you're not able to march in place, but you can stand up, then we would mark you as a yellow. So this just helps us to make sure we use the right equipment so that you don't fall or get hurt and that everybody's consistent.
Okay. It sounds very safe.
Any questions on that?
No, none
And
so
we're going
far.
to do this every time you get up out of bed, okay?
Okay.
And like I said, it doesn't take very long because we're going to run through it right now.
Oh,
Are
okay.
you ready to get up out of bed?
Yes.
Okay. Good morning, Robert.
Good morning.
As we discussed, I know you need to go use the restroom, so every time you
Yes.
get up out of bed, what are we going to do with you?
We're gonna do the mobility.
Yeah, we're going to do the mobility safety check, okay?
Right.
I know you're strong, but we just never know with medication. So
Right.
the first thing we're going to do is see if you can roll over from side to side. Are you
Okay.
able to roll over towards the other side? You can use the side rail.
Yes.
And when we're doing this check, I'm not going to help you. This is what you can do for yourself.
Okay.
All right. Perfect. Good.
All right.
Great. Can you roll over onto this side? Once you roll over onto this side, if you're able to do that, we'll have you sit up, okay? Perfect.
Okay.
All right, so why don't you bring your feet over to the edge and try to sit up?
Okay.
Perfect. Good, and scoot to the edge of the bed. And now we want to see if you're able to sit up for about 2 minutes. So this is a good time to ask how you're feeling. Do you have any pain right now?
Oh, no pain so far.
No. Are you dizzy?
No. Not dizzy.
No. Everything doing okay?
So far, so good.
Good. And then it would be a good time to listen to your chest if we hadn't done so already. So nurses, it's a good time to do any type of assessment, some part of your head to toe assessment too.
Mm-hmm.
You still doing good?
Yes.
All right. So next thing I'm going to ask you, Robert, is to raise your arms up and down.
Okay.
Good. Next thing I want you to do is just kick your leg up and down one at a time. We're looking to make sure that you have good strength in your legs and you're able to follow direction. So that's wonderful. You're still doing all right? No dizziness?
No dizzy.
Awesome. So next step is to see if you can stand up now.
Okay.
And we don't want you to start walking, Okay, we're going to
Okay.
stand up and pause.
Okay.
So go ahead and try to stand up, and you can use the side rail.
All right.
Perfect. Good. And we're going to stand here for about a minute or so, because
Okay.
we never want to get up too fast, right? Because you might get dizzy because of medication. How's the pain in your belly?
It's okay.
Doing okay?
Yes.
Good. All right, the next step is to see if you can march in place.
Okay.
Can you march in place? Perfect. One last thing, just take a step forward and back for me. Great. Now let's go use the restroom.
Okay.
All right.